So now we're going to move on to the last topic for Module 1, Class 1 for GNP3. It may get pushed off to Class 2. We probably won't have time to cover it for the first class, but it's Preconception Counseling. I'm hoping this video runs slightly under 5 minutes, at the most 10. It's just basic health promotion information. The benefits of preconception counseling are fairly obvious. The goal of preconception counseling for a woman who wants to become pregnant or for a couple looking to achieve pregnancy is to put that family in the best shape possible, to have a healthy pregnancy and a good outcome. So some obvious things, we can identify risk factors. For example, we have lifestyle risk factors like smoking or exposure to alcohol, drugs, and also maybe some pre-existing conditions women weren't aware that they had. For example, hypertension, it's a silent killer. So a woman may not be aware that she has chronic hypertension. So we can screen for that. We can identify it and treat it and get it under control before a pregnancy occurs and minimize the mom's risk for that pregnancy. We can also help mom modify the lifestyle. We can offer her tools such as smoking cessation. Weight management's a big one. A lot of people aren't aware of the impact obesity has on pregnancy. There's a lot of research coming out now about the impact of obesity. So weight management could be something that we offer people, and dietary counseling. Medical management of pre-existing conditions. So if you have somebody who maybe has type 1 or type 2 diabetes prior to pregnancy, we want to get their blood sugar under control. Other women may have medications that are incompatible, whether for physical conditions or psychiatric conditions, and we want to maybe make some changes to those medication management to make sure that mom has no exposure to a drug that might harm her fetus, and also that her physical health is optimized. And then we can limit exposure to teratogens. So for example, if a woman's due for dental x-rays, we can tell her, go get them now before you're pregnant, because exposure to radiation we know can harm a fetus. So those are some obvious benefits of preconception counseling. So what does preconception care look like? It can be offered in primary care, but more often you'll see people referred to perinatologists or even fertility doctors if that's an issue for them. We want to get a thorough history, both personal and family, find out if there are any inherited conditions, find out if mom has any pre-existing medical conditions that might pose risk factors. So we're going to get a complete medical history. It can also include a social and psychological history, screening for social determinants of health, occupational hazards, and mental illness. We want to review any and all medications she's on and any over-the-counter or herbal supplements that she might be taking, and we may have to modify those. A lot of conditions require treatment through pregnancy, and the medications may have some risk, but that risk is not outweighed by benefits. It's important for women to know not to stop their medications when they become pregnant. So preconception is a good time to discuss that. Physical exam starts with your basic history and physical. You're going to look at BMI and nutritional factors. You're going to check vital signs. You'll do, routine lab work. A pap smear and pelvic exam are also an important component. The lab work that we look at, CBC can tell you a lot about whether a woman's nutritional status is optimized, especially if she has low hemoglobin. We want to supplement her now. It can point out to risk factors related to folic acid. We can screen for STIs that might either impair fertility or jeopardize a pregnancy. And we can check her rubella status. Rubella is also known as German measles. We are seeing a rise in a lot of vaccine-preventable illnesses because some people choose not to vaccinate. And rubella, a rubella vaccine is a live vaccine, cannot be given during pregnancy. So ideally the time to screen for this would be preconception. German measles does cause severe impact to the fetus, especially at certain critical times of development. So those are some of the blood tests that might be ordered. We're going to screen mom for exposure to hazards. For example, do you work with chemicals? Are you exposed to environmental pollution of any kind? And we're going to do a thorough psychosocial assessment to make sure that mom is in the best possible shape. Not to make the decision for her whether or not to have children, but mostly to get her some help if she needs it. So who do we refer for preconception counseling? So ideally, everybody of a childbearing age who desires a pregnancy at some point in their lives, and even we can do some anticipatory guidance for people who don't, knowing that 49% of pregnancies are unintended. At every primary care visit, women should be asked, are you planning to get pregnant within the next year? If a woman says no, then we evaluate her contraceptive history and see if we need to offer her something that is more effective or more palatable to her. If she says yes, then we want to discuss the value of preconception counseling. Minimally, we are going to refer people if we know that they have risk factors. For example, women with pre-existing diseases like diabetes. Diabetes can cause serious neural tube defects. It's really uncontrolled diabetes. Neural tube defects, heart defects, stillbirth, higher rates of spontaneous abortion, also known as miscarriage. Hypertension creates a lot of risk factors for pregnancy. HIV. There are a lot of medications for HIV that are not only compatible with pregnancy but can prevent vertical transmission to the fetus. Obesity, as I've mentioned. Weight loss is not indicated during pregnancy. We don't want women to restrict their caloric intake then. But obesity can impact a pregnancy very profoundly in some instances. It also impacts the labor and delivery experience, and we'll talk more about that later when we talk about labor at risk. But these women should be referred for preconception counseling so that we can manage these risk factors before pregnancy occurs. Women over the age of 35 or women who are getting close to 35, who would be 35 at time of delivery, should be counseled about the risks of pregnancy in the advanced maternal age or AMA category, including risks to themselves, not just the genetic risks, but risks for diabetes, hypertension, etc., and ways to stay healthy if you are pregnant and over 35 or planning a pregnancy over 35. Any woman or actually couples with a personal or family history of an inherited condition, and we'll find out more about that in the genetics lecture which follows this one. And women with exposure to environmental hazards. If we know that mom, let's say, works in a factory or works even is a nurse and is exposed to diseases, x-rays, things like that, we might want to refer her for preconception counseling so she has a good idea how to minimize her risk. Okay, that was it. Can't say it enough. Thank you for listening. I do appreciate that you are preparing for class. I know it will pay off for you in the long run, and that's it for me. Thank you and good night.